If you are over 50, chances are you've opened a medical bill recently and thought, how can anyone survive these costs? You are not alone. Across the United States, millions of seniors face medical bills that climb higher every year, even for routine care. It's frustrating, exhausting, and sometimes downright scary. Many seniors start to feel trapped, worrying not just about their health, but about their finances, retirement, and the future. Today, we're going to break down exactly why medical costs are so high for Americans over 50 and give you the foundation to take control before these costs drain your savings. By the end of this video, you will know the key reasons behind soaring bills and how to start reducing them immediately. The first reason healthcare is so expensive is simple. As we age, our bodies need more attention. Health isn't just a concern, it's a daily necessity. By the time we reach 50, most of us face more frequent doctor visits, regular screenings, medications for chronic conditions, and sometimes unexpected emergencies. Even if you feel healthy, preventive care is critical, and that comes with a cost. Blood pressure checks, cholesterol monitoring, diabetes screenings, vision and hearing tests. All these add up, especially when you need more than one test or multiple specialists. One routine checkup can easily turn into several $100s when you add lab work, imaging, and specialist fees. The body simply demands more care, and the system charges more for it. Insurance might seem like a safety net, but in reality, it often doesn't cover as much as you think. Many seniors assume that having insurance solves all their medical cost problems. But in today's healthcare landscape, this is far from the truth. Even with insurance, seniors often pay high premiums, deductibles, copays, and co-insurance. Some bills include out-of-network fees that come as a complete surprise. And for Americans aged 50 to 64 who are not yet eligible for full Medicare benefits, coverage gaps can create major financial stress. Even those on Medicare can face rising premiums for Part B and Part D, which cover doctor visits and prescription drugs, respectively. Understanding exactly what your insurance covers and where it doesn't is one of the most important steps you can take to reduce costs. Prescription drugs are another huge factor. Drug prices in the U.S. have risen dramatically over the past decade. Many seniors find themselves paying hundreds, sometimes thousands, per year just to maintain the medications they need. Generic alternatives often exist, but doctors don't always prescribe them, and pharmacies sometimes charge different prices for the same medication. What makes it worse is that insurance plans frequently change their formularies, meaning the drugs your insurance used to cover may suddenly cost more. Seniors are often left scrambling to pay for essential medications or to choose between medications and other basic needs. Unexpected hospital visits can be financially devastating. One trip to the emergency room, one overnight stay, or even a short observation period can result in bills larger than the car payment or a year's worth of groceries. Hospitals charge for each test, each service, and each day of care, often inflating prices for procedures that, in other countries, would be far cheaper. Many seniors avoid going to hospital unless it's absolutely necessary because they fear these costs. But avoiding care can lead to worse health outcomes and even higher bills down the line. The fear of medical bills becomes a trap, and too many seniors find themselves caught in this cycle. Medical billing is another area where the system seems to work against you. Bills are confusing, often arrive months after treatment, and contain errors. Some studies show that a significant percentage of hospital bills have at least one mistake. Yet most seniors simply pay because they feel they have no choice. Duplicate charges, incorrect coding, and out-of-network fees for services that should be covered are far too common. The good news is that these errors are often fixable if you take the time to review your bills carefully, request itemized statements, and ask questions. One phone call can sometimes save hundreds of dollars, but most people don't realize they have that power. Beyond the numbers, the emotional toll of medical costs is enormous. Stress, anxiety, and fear of financial ruin can affect both physical and mental health. Many seniors delay doctor visits, skip tests, or avoid filling prescriptions simply because they fear the cost. Ironically, this often leads to worse health outcomes and, in turn, higher medical bills. Stress alone increases the risk of heart disease, diabetes, and other chronic conditions, creating a vicious cycle. Learning how to manage healthcare costs isn't just about saving money. It's about protecting your health and peace of mind. Understanding why medical costs are so high is the first step toward control. But knowledge without action isn't enough. There are smart, proven strategies seniors can use to take control of their healthcare spending, and it starts with awareness. By understanding the system, asking questions, and exploring every available resource, you can begin to reduce costs immediately. Whether it's reviewing insurance plans, challenging bills, or leveraging assistance programs, the steps you take today can prevent thousands of dollars in unnecessary spending tomorrow. For example, insurance reviews can save hundreds per year. Many seniors never compare their plans year to year, assuming the plan they had last year is still the best. But premiums, deductibles, copays, and networks often change. Taking the time to compare multiple plans, especially during open enrollment, can lead to substantial savings. For seniors on Medicare, reviewing Medicare Advantage and Part D plans annually is crucial. Even small adjustments, like switching to a lower premium plan or ensuring your preferred doctors are in-network, can reduce your annual healthcare expenses significantly. Challenging medical bills is another underutilized strategy. Many seniors simply pay bills without examining them, believing that there's no alternative. But hospitals and providers expect questions. Requesting an itemized bill, comparing it with your insurance explanation of benefits, and asking for clarification can reveal errors and overcharges. Some hospitals even have financial assistance programs that reduce bills if you ask. These small steps require effort, but they can make a huge difference in your total costs. Prescription management is equally important. Doctors may not always know the cost of the medications they prescribe, and generic alternatives are often available. Asking for generics, checking different pharmacies, using discount programs, and discussing dosage alternatives can all reduce costs. For example, a senior who switched to generics and used pharmacy discounts could save hundreds or even over $1,000 per year. The key is advocacy. Speak up, ask questions, and don't assume the first option is the only option. Preventive care also saves money. Simple lifestyle choices like walking, eating balanced meals, managing stress, and sleeping well can reduce doctor visits, hospitalizations, and medications. Preventive screenings and vaccinations are often fully covered, and early detection of conditions can prevent costly emergencies. Mental health matters as well. Loneliness, depression, and anxiety increase medical costs and reduce quality of life. Staying socially connected is not just emotionally healthy, it's financially smart. Finally, seniors don't need to navigate the system alone. Free or low-cost professional help exists. State health insurance assistance programs, SHIPs, nonprofit advocates, hospital financial counselors, and Medicare counselors can help you review plans, appeal denied claims, and find assistance programs. Many seniors never use these services, yet they can save thousands of dollars and prevent unnecessary stress. Using available resources is not just wise, it's your right as a taxpayer and a patient. By now, you understand why medical costs are rising and how the system works. Knowledge is the first step. Action is the next. In Part 2, we'll dive deeper into the first 2 of 5 proven strategies to cut your medical costs immediately, with real-life examples, step-by-step instructions, and tips most seniors have never heard before. You'll learn how to review your insurance effectively, spot billing errors, and start saving money on prescriptions and care without sacrificing quality. Stay tuned, because Part 2 will show you how to take control of your healthcare spending and protect your health and your wallet in 2026. If you ever felt frustrated, stressed, or trapped by medical bills, this is a part where things start to change. Remember, knowledge without action doesn't help, but the strategies we'll share are fully actionable and designed to work for seniors over 50 in the real world. Welcome back. In Part 1, we discuss why medical costs for Americans over 50 are skyrocketing, from insurance gaps to prescription drugs, hospital fees, and confusing billing. Now it's time to move from understanding to action. In this section, we'll focus on the first 2 of 5 proven strategies that can save you hundreds or even thousands of dollars a year without compromising your health. Many seniors assume that the insurance plan they chose last year is still the best option. This is a costly mistake. Health insurance plans change every year. Your premium might go up, your deductible might increase, Your medications might be moved to a higher cost tier, or your doctor might leave the network without your knowledge. By not reviewing your plan annually, you could be leaving hundreds or even thousands of dollars on the table. Here's how to take control. First, always review your insurance during open enrollment. Compare at least 3 different plans if possible, even if you feel stuck with one. Look closely at premiums, deductibles, co-pays, co-insurance, and out-of-pocket maximums. Also, check if your preferred doctors and pharmacies are in-network. A plan with a slightly higher premium but a lower deductible and a fully in-network network could save you more in the long run. For seniors on Medicare, the stakes are higher. Medicare Advantage, Part D prescription plans, and supplemental coverage all have subtle differences that can make a huge impact on costs. For example, switching from original Medicare with a Medigap plan to a carefully selected Medicare Advantage plan could reduce your annual medical spending significantly while still covering the services you need. The key is to review, compare, and adjust every single year. Real-life example. Mary, 62, discovered that her Part D prescription plan no longer covered a key medication for arthritis. By comparing 3 alternative plans during open enrollment, she found a plan that covered the medication fully and even reduced her monthly premium by $45. Over a year, that saved her more than $500 just by taking 30 minutes to review her options. Another tip is to understand the fine print. Many seniors focus only on premiums, but a low monthly premium can be misleading if the deductible is extremely high. Look at the total potential cost. Premium plus deductible plus co-pays plus co-insurance. Sometimes paying a slightly higher premium upfront is cheaper in the long run because it lowers out-of-pocket spending. Finally, don't ignore supplemental coverage. Programs like Medigap policies exist to fill gaps in original Medicare coverage. Depending on your health needs, a supplemental policy could save you thousands each year on hospital stays, emergency visits, and even some prescription medications. This may sound tedious, but questioning medical bills is one of the most powerful ways to reduce costs, and yet most seniors never do it. Hospitals and providers make mistakes all the time. Duplicate charges, incorrect coding, out-of-network fees for in-network care. These are more common than most people realize. Step 1. Always request an itemized bill. It might look intimidating at first, full of codes and medical terminology, but this document is your ticket to saving money. Compare it with your insurance's explanation of benefits, EOB, to ensure each charge matches what your insurance says it should cover. Step 2. Look for unfamiliar or duplicate charges. For instance, one senior discovered she was billed twice for the same lab test during a routine checkup. Another was charged for a specialist visit she never attended. These errors are often corrected once you ask, sometimes resulting in a 40% or more reduction in the total bill. Step 3. Call the billing department and negotiate. Hospitals and doctors' offices often have financial assistance programs, discounts for early payment, or hardship plans. If you explain your situation, many are willing to reduce your bill or allow a manageable payment plan. The key is to ask. Most people assume the answer will be no, but in reality, the answer is often yes. Step 4. Appeal denied insurance claims. If your insurance refuses a claim, don't accept it. There's usually a formal appeal process, and many denied claims are overturned on appeal. For example, a 68-year-old man was denied coverage for a follow-up test after surgery. He submitted an appeal with documentation from his doctor, and his insurance not only approved the claim but reimbursed him for the initial out-of-pocket payment. Step 5. Keep detailed records. Save every bill, EOB, receipt, and correspondence with providers or insurance companies. This makes it easier to track errors, appeal claims, and negotiate bills. A well-documented case is almost impossible for insurance or hospitals to ignore. Real-world impact. Imagine receiving a $2,400 hospital bill with multiple errors. After carefully reviewing the itemized statement and contacting the billing department, a senior was able to reduce it to $1,200. That's a $1,200 savings on a single incident, enough to pay for medications or groceries for several months. Questioning bills isn't just about saving money. It's also about empowerment. Seniors who take control of their medical bills often feel less stressed and more confident managing their health. Instead of feeling trapped, they feel in charge. These two strategies are powerful individually, but combined, they're even stronger. Reviewing insurance ensures you are on the plan that costs the least for your health needs. Questioning bills ensures you never overpay for care you've received. Together, these strategies provide immediate and long-term financial relief. For example, John, 65, had a high-deductible Medicare Advantage plan and didn't realize a better option existed. After switching plans during open enrollment, he saved $600 in premiums for the year. Later, he discovered a duplicate charge for a lab test, which saved another $200. That's an $800 total savings in a single year with just a few hours of effort. These strategies also reduce stress. Know you're paying only what you should and that your plan is the most cost-effective gives peace of mind. Stress itself is a health risk. So by taking control of your insurance and bills, you're also indirectly protecting your health. Practical tips for getting started today. Set aside 1 hour this week to review your current insurance plan. Note your premium, deductible, copays, and network coverage. Request your most recent medical bills and compare them with your insurance EOBs. Look for duplicate charges or errors. Make a simple log. Record the date, service, amount charged, insurance coverage, and any questions you have. Call the billing department. It's usually easier than you think. Explain that you are reviewing charges for accuracy and ask politely if anything can be corrected or reduced. Use free resources. Medicare counselors, nonprofit patient advocates, or state assistance programs can guide you through plan comparisons and bill appeals. Starting small yields results. Even saving a few $100s a year on insurance and medical bills is a meaningful difference, especially for seniors living on fixed incomes. Emotional connection and engagement. Think about this. Every dollar you save by reviewing insurance or challenging a bill is a dollar you can spend on something meaningful. Maybe it's a medication that keeps you mobile, a hobby you love, or time with your grandchildren. Medical cost control is not just about money. It's about preserving freedom, dignity, and peace of mind. Seniors often feel invisible in the healthcare system, but by mastering insurance and questioning bills, you assert control. You send a message, I am informed, I am careful, and I will not be overcharged. This confidence alone can transform how you approach your health and finances. We've covered the first two strategies, mastering insurance and questioning bills. In Part 3, we'll dive into strategies 3 and 4, which focus on prescriptions and preventive care. These strategies are often overlooked, yet they can cut costs dramatically and improve your health at the same time. We'll give real-life examples, step-by-step guidance, and tips that most seniors have never heard of before. If you've ever struggled to pay for medications or worried about avoidable hospital visits, Part 3 is going to be a game changer. Remember, each strategy builds on the previous one. By the time we finish all 5, you'll have a complete roadmap to reduce your medical bills and protect your health in 2026. Welcome back. So far, we've explored why medical costs are skyrocketing for Americans over 50, and we've covered the first 2 powerful strategies, mastering your insurance and questioning every medical bill. These strategies alone can save you hundreds, even thousands of dollars a year. But to truly take control of your health care costs, we need to focus on what many seniors overlook: prescription management and preventive care. These are strategies number 3 and number 4, and they have the potential to transform not just your budget, but your health and peace of mind. Prescription drugs are one of the biggest expenses for seniors. Even with insurance, many Americans over 50 spend hundreds of dollars monthly on medications. And with prices rising every year, it's easy to feel trapped. But there's good news. By taking control of your prescriptions, you can save significant amounts of money without compromising your health. The first step is to ask your doctor about generic alternatives. Many medications have generics that are just as effective as the brand name version, but cost a fraction of the price. For example, a common cholesterol medication might cost $250 per month brand name, but only $20 as a generic. Many seniors continue taking brand name medications simply because they assume their doctor prescribed the best option. but speaking up can save hundreds or thousands annually. Next, compare pharmacy prices. Not all pharmacies charge the same amount for the same drug. Some national chains may charge more than local or independent pharmacies. Even large online pharmacies or discount programs like GoodRx can offer substantial savings. A senior who switches pharmacies for a single medication could save $15 to $50 per month per prescription. Multiply that by 5 or 6 medications, and suddenly your savings are substantial. Medication adherence is also important. Skipping doses to save money may seem like a solution, but it can worsen health and lead to higher costs later. Instead, work with your doctor to explore lower-cost dosing options, like splitting pills when appropriate or switching to longer-acting versions. Some medications allow for half doses or combination pills that reduce overall cost. Always confirm with your doctor before making any changes. Another tactic is to use manufacturer or pharmacy discount programs. Many pharmaceutical companies offer assistance for seniors on a fixed income, sometimes reducing monthly costs by 50% or more. Nonprofit programs exist as well, especially for high-cost medications like insulin or arthritis treatments. These programs are underutilized. Many seniors don't even know they exist. Real-life example. Sandra, 68, was spending $400 per month on 5 prescription medications. After switching to generics, using a local pharmacy with discount pricing, and enrolling in a manufacturer program for her arthritis medication, she cut her monthly cost to $125. That's a $275 monthly saving, over $3,000 a year, without changing her care. The key takeaway: never accept the first price, and never assume brand name is your only option. Ask questions, compare prices, and explore assistance programs. Each small step compounds into significant yearly savings, while also ensuring you maintain your health. While prescription management saves money directly, preventive care and lifestyle changes reduce future medical bills. This is perhaps the most overlooked strategy among seniors, yet it's one of the most powerful. Preventive care is not just about getting checkups. It's about catching problems early, avoiding costly treatments, and staying healthy longer. Most insurance plans, including Medicare, cover many preventive services at little or no cost. These include annual physicals, mammograms, colonoscopies, blood pressure checks, diabetes screenings, cholesterol tests, flu vaccines, and certain vaccines like shingles and pneumonia. Skipping preventive care might seem like a short-term saving, but it's a false economy. Catching conditions early, like high blood pressure, prediabetes, or early-stage cancer, can save thousands of dollars in emergency visits, hospital stays, and surgeries later. For example, an annual colonoscopy might cost a few $100s, but early detection of polyps can prevent colon cancer, which could cost tens of thousands to treat if discovered later. Lifestyle adjustments are equally important. Simple, low-cost habits can have a dramatic impact on long-term health and healthcare costs. Walking 30 minutes daily improves cardiovascular health, reduces joint stiffness, and lowers the risk of diabetes. Eating a balanced diet rich in fruits, vegetables, lean proteins, and whole grains supports energy, weight management, and disease prevention. Even small changes, like reducing sugar intake, limiting processed foods, and staying hydrated, have measurable health benefits. Stress management is another critical factor. Chronic stress increases blood pressure, weakens the immune system, and worsens heart health. For seniors, loneliness and isolation amplify these risks. Staying socially connected through friends, family, clubs, or community activities not only improves mental health, but also lowers healthcare costs. Mental health screenings and professional support can also prevent conditions like depression or anxiety from escalating into expensive medical problems. Real-life example: Thomas, 72, started walking daily, joined a local senior center, and made small changes to his diet. Over a year, he reduced his blood pressure medication dosage, avoided an emergency hospitalization for hypertension, and felt more energetic. The savings on medications and hospital costs, combined with improved quality of life, were significant. Preventive care also includes screenings tailored to your age and risk factors. Women over 50 should continue regular mammograms and bone density tests. Men should monitor prostate health and cholesterol. Seniors with a family history of heart disease should prioritize cardiac screenings. By staying proactive, you reduce the likelihood of surprise medical emergencies, which are often the most financially devastating. When these strategies are combined, the impact is exponential. Managing prescriptions keeps your ongoing monthly costs low, while preventive care ensures that your health remains stable, avoiding high-cost emergencies. For instance, a senior who optimizes medications and stays on top of screenings may avoid hospitalizations entirely, saving thousands each year. Actionable tips for today. Review your prescription list with your doctor. Ask about generics, dosing alternatives, or combination pills. Compare pharmacies and use discount programs like GoodRx or manufacturer assistance. Schedule preventive screenings. Don't skip annual checkups, vaccines, or recommended tests. Incorporate small lifestyle changes. Walk daily, eat balanced meals, manage stress, and maintain social connections. Track your progress. Record medications, doses, doctor visits, and screenings to stay organized and catch errors early. These steps might seem small individually, but over time, they reduce financial stress, lower out-of-pocket costs, and improve your health. Think about it this way. Each time you invest in preventive care, you're not just spending money, you're investing in freedom. Freedom from fear of surprise bills, freedom from unnecessary hospitalizations, and freedom to live a healthier, more active life. Medication management and lifestyle improvements are not just financial strategies. They're health strategies that protect your independence and your quality of life. Imagine waking up knowing your prescriptions are affordable, your doctor visits are covered, and you're doing everything you can to prevent future medical emergencies. That peace of mind is priceless. And the best part? It's achievable even for seniors on a fixed income. By taking these simple, actionable steps that in the final part 4, we'll reveal strategy number 5, using professional help and assistance programs, plus bonus tips that most seniors never hear about. These tips can save thousands more, reduce stress, and even provide options for long-term care planning. We'll also summarize all 5 strategies and give complete step-by-step roadmap, so that viewers can start immediately reducing healthcare costs while staying healthy and independent. Part 4 is the most actionable section yet. You won't want to miss it, especially if you're tired of being overwhelmed by bills and want clear, practical ways to take control. Welcome to the final part of our video. By now, you know why medical costs are soaring for Americans over 50, and you've learned the first 4 strategies: mastering insurance, questioning every bill, managing prescriptions, and using preventive care to reduce long-term costs. In this final section, we'll cover strategy number 5, professional help and assistance programs, plus bonus tips, real-life examples, and a complete step-by-step roadmap, so you can start saving money and protecting your health today. Many seniors assume they must navigate the healthcare system alone, but that's not true. There are professional resources designed specifically to help you manage insurance, bills, and medical expenses. The problem is that most seniors don't know they exist, or they believe the process is complicated. In reality, using these services can save thousands of dollars annually and reduce stress dramatically. Step 1. State Health Insurance Assistance Programs, SHIPs. These government-sponsored programs provide free counseling to Medicare beneficiaries. SHIP counselors can help you compare Medicare Advantage and Part D plans, review supplemental coverage, appeal denied claims, understand cost-saving options for medications and medical services. SHIP counselors are trained, free to use, and available in nearly every state. Many seniors overlook this resource and miss out on potential savings of hundreds or even thousands per year. Step 2. Nonprofit patient advocates. Many organizations like patient advocacy groups and senior support networks can review your medical bills, help negotiate reductions, and guide you through appeals. They often work on a free or low-cost basis, especially for seniors on fixed incomes. One study found that hospitals and advocacy programs could reduce bills by an average of 25 to 40% when seniors ask for assistance. Step 3. Hospital Financial Assistance Offices. Most hospitals have dedicated departments to help patients manage costs. They can provide payment plans with zero or low interest, sliding scale fees based on income, discount for uninsured or underinsured patients. All you need to do is call, explain your situation, and ask what programs are available. You'll often be surprised at how much help exists, Help that many seniors never take advantage of simply because they don't ask. Step 4. Medicare Counseling Services. These services guide seniors through every aspect of Medicare, including supplemental plans, prescription coverage, and navigating complex billing issues. Counselors can also help you identify opportunities to save money and access free or low-cost preventive services. Consider Robert, a 70-year-old retired teacher. He had multiple chronic conditions, including diabetes and high blood pressure, and his monthly medical costs were over $1,200. By working with a SHIP counselor and a nonprofit patient advocate, he was able to switch to a Medicare Advantage plan that lowered premiums by $350 per year, access manufacturer assistance programs for insulin, saving $400 per year, negotiate a hospital bill that was incorrectly coded, saving $1,200. In total, Robert saved nearly $2,000 in just 1 year, all by using resources that were available for free. Beyond the money, the stress relief was significant. He no longer feared unexpected medical bills and felt more confident managing his health. Even after applying all 5 strategies, there are additional ways seniors can protect their health and finances. Bundle appointments strategically. Instead of multiple trips to different offices, try to schedule lab tests, imaging, and doctor visits on the same day. This reduces travel costs, time, and co-pays. Ask for cash pricing. Sometimes paying cash for minor procedures or tests outside of insurance coverage can actually be cheaper. Always compare prices before committing. Telemedicine options. Many insurers now cover telehealth visits, which can save on travel co-pays, and sometimes even prescription costs. Telehealth is especially useful for follow-ups or consultations that don't require in-person visits. Wellness programs and community resources. Senior centers, local nonprofit, and community hospitals often offer free or low-cost exercise classes, nutrition counseling, and disease management programs. Participation in these programs reduces long-term costs by improving health and preventing disease. Track your spending. Keep a simple notebook or spreadsheet of all medical expenses, including medications, doctor visits, and insurance payments. Seeing the numbers in front of you makes it easier to spot opportunities to save. Ask for preventive screenings proactively. Even if your doctor doesn't mention them, request screenings recommended for your age and risk factors. Early detection can prevent expensive emergencies. Let's look at a few more examples of seniors who combined all 5 strategies and saw major results. Example 1. Linda, 65. Linda had multiple prescriptions and a high-deductible insurance plan. By reviewing her insurance, using generics, and enrolling in a manufacturer assistance program, she reduced her medication costs by $250 per month. She also used preventive care to catch a minor thyroid issue early, avoiding a hospital visit that could have cost thousands. Example 2. Frank, 68. Frank frequently traveled for work before retiring and had inconsistent insurance coverage. By working with a SHIP counselor and questioning his medical bills, he reduced overcharges totaling $1,000. He also adopted daily walking and diet changes that lowered his blood pressure and reduced the need for medication adjustments. Example 3. Maria, 70. Maria relied on community wellness programs and nonprofit patient advocates. She received free health coaching, nutrition advice, and advocacy for insurance claims. Her total savings on bills and medications exceeded $2,500 in 1 year, and she reported feeling healthier and less stressed than ever. These stories highlight the point. Being proactive, informed, and willing to ask for help is what truly reduces healthcare costs. Here's a practical roadmap. You can start today. Step 1. Review your insurance annually. Compare plans, check premiums, deductibles, and coverage. Confirm your doctors and pharmacies are in-network. Consider supplemental or Medigap plans. Step 2. Question every bill. Request itemized bills and compare with your insurance EOBs. Look for duplicate or incorrect charges. Call the billing department and negotiate if necessary. Keep detailed records for appeals. Step 3. Manage prescriptions wisely. Ask about generics and alternative dosing. Compare pharmacy prices. Enroll in manufacturer or nonprofit assistance programs. Avoid skipping doses to save money. Step 4. Prioritize preventive care and lifestyle. Schedule screenings, checkups, and vaccinations. Walk, eat balanced meals, and manage stress. Stay socially connected to reduce mental health risks. Step 5. Use professional help. Contact SHIP counselors for Medicare guidance. Work with nonprofit patient advocates for billing and claims. Explore hospital financial assistance programs. Leverage telemedicine and community wellness resources. Bonus tips. Bundle appointments. Consider cash pricing for minor services. Track spending diligently. Engage in preventive and early detection measures. By following this roadmap, seniors can regain control over their healthcare spending, reduce stress, and improve overall health. Every small action compounds into significant savings over time. Imagine this. No more surprise bills. No more anxiety about which medication to skip. No more fear of hospital costs derailing your retirement or savings. You are in control. You know your options, your rights, and strategies at work. You are proactive, informed, and empowered. Taking even one of these strategies today, reviewing insurance, questioning a bill, adjusting prescriptions, or scheduling preventive screening, sets you on a path to financial and health freedom. Combine all 5 strategies, and you're not just saving money. You're protecting your life, your independence, and your peace of mind. If this video helped you, hit the like button so other seniors can see it. Subscribe to Informative Zone for trusted health and financial tips after 50. Comment below. Which strategy will you start today? What medical cost worries you the most? We read every comment and provide personalized guidance whenever possible. This video is for educational purposes only and does not replace professional medical, financial, or insurance advice. Always consult a qualified healthcare provider or insurance professional regarding your personal situation.